I'm Roger Reed. I'm a chiropractor in Paddington, London. Today I'm going to talk about neck pain, acute neck pain. If you wake up and your neck's jammed and you're stuck, you can't turn to the one side, you might have range of motion, it's better to the other side, but you're a bit restricted to the one side. You won't want to bend to the same side, you won't want to bend backwards too much and pretty much feel frozen in the same position over there. This is sometimes caused by a bad sleeping position. We try and get people not to sleep on their front with their neck rotated and extended. It's not a very nice position for the neck to be in. So if you wake up and you're feeling stiff and tight, what should you do? First things, a hot shower will soften the muscles and loosen up the muscles and make you feel a bit better. Ice is really good for acute pain, so that'll help calm down the inflammation, and you can get a bag of frozen peas, brush your frost off, stick it over some light material so it's not straight onto the skin, and you wrap it right over the painful side. Not so much on the muscles on the front, but right over the neck and back, the corner of the neck over there, usually where it's the most painful. And you leave it on for 10-15 minutes until it goes numb. As soon as it goes numb, whip it off, wrap up nice and warm, keep the muscles nice and warm the rest of the time. Try and avoid cold drafts and air conditioners and open windows and that sort of thing. Other things that are really helpful, nice big shoulder rolls, squeezing your shoulders up towards your ears, squeezing them back, dropping down. Head stays neutral, we're not flopping our chin up and down, that'll hurt. Keep your chin down slightly, and you just do nice big shoulder rolls, nice big shrugs. And you can do 10 of those, and you can do them 10 times a day, hourly. They're really helpful to do often. Okay. The other things that are helpful is moving your neck, but in a pain-free range of motion. So you'll find you're a little bit between a rock and a hard place. If you do too little, everything tightens up and tightens up and tightens up. If you do too much, it'll flare up and aggravate things. So movement is good, but only where there's no pain. So if I can move up to there and further around this way, that's fine, but only where there's no pain. So you do looking left, looking right. If you've got better range of motion, you can try and keep that range of motion going. But 10 times left, 10 times right. Nice, slow, gentle rotations, breakfast, lunch and supper. The other one that's really helpful, and not so much in the first 2 or 3 days when you're in acute pain, but after that you can gently drop the chin down and slide the chin backwards and then come up to there. Chin down, slide the chin backwards, and when you can't go anymore you lift your chin up just so your eyes are horizontal. So we're trying to avoid any extension exercises. Not so helpful, your body won't like you for that. Other things I'm not so keen on is the lateral bending. It's not so helpful. Usually it will be painful and aggravated on the side that's painful, and going that way will irritate it. If you're going to do any lateral flexion, put your chin down first, just as far as you can, and go very gently side to side. But again, always in the pain-free range of motion. Try and avoid taking too many painkillers as they mask the symptoms and let you do things that you shouldn't be doing. Drink lots of water and keep the muscles really nice and warm the rest of the time. But the ice is really helpful. First 3 days, 3 times a day, really helpful. Hope that helps. Obviously, get in to see a chiropractor as soon as you can. Usually 24 to 48 hours will have you feeling a whole lot better. If you do nothing with these, they'll drag on for a week. They may well calm down on their own, but then you'll find your range of motion will still be somewhat restricted, and the next time you sleep in a bad position or have too long at the computer, the whole thing will kick off again. So the sooner you can get it resolved and sorted out with a good chiropractic adjustment, the better.